Hi, Emily.
Hi, Dr. Murphy. Nice to meet you. You have a beautiful facility.
Oh, thank you.
Here's my resume.
Okay, great. Okay, so tell me a little bit about yourself.
Well, my name's Dr. Emily Lash, DPT, and I got my doctorate and my undergrad from Ithaca College, and I graduated in 2014 with my undergrad. I graduated cum laude, and I also double minored in health communication, nutrition promotion. And while I was at Ithaca, I played varsity field hockey for 4 years, and senior year I was voted the captain. And I was also involved in various clubs and organizations like Relay for Life and Habitat for Humanity.
Wow, that sounds great. So tell me about your strengths.
So I'm really a team player. Being a part of a team, I really find that being a leader is such a great role to play because you have to be concerned about everyone else as well as yourself, which kind of relates to physical therapy because I know you have a lot of great staff with lots of different specialties, so I'm sure I'd like to work with everyone in your company. And one of my weaknesses is that I do get very attached to my patients. I end up talking to them, sometimes getting involved in their personal life, which obviously PT, we have limited time with our patients, so I just need to stay on track. And also during my clinicals, I know sometimes I struggled with taking a short time to write my patient notes, sometimes working with different electronic medical records versus handwritten notes. Sometimes I need to just work on my speed for that.
No, sure. So what interests you about this job?
Well, I love your facility, and I love that your practice focuses on manual therapy, and both you and Dr. McCune have your fellowship, and everyone is OCS certified, and I looked on your website, and a lot of your employees have various specialties like kinesiotaping, soft tissue mobilization, and incontinence issues, women's health. Those are a lot of things I got to kind of just try my hand in during my clinicals. So I'd love to kind of see which area of specialty that I would really like and to fit into. So I love that. And I also love that you do kind of fitness classes, not in physical therapy, but during the evenings. And I love that. I would love to be involved in teaching some of those classes. So I think that's a great asset to your company.
Sure, that sounds great. What experiences have prepared you for this job?
During some of my clinicals, I worked on outpatient physical therapy, and that was not as much time as I worked in an inpatient facility, but that was just a great kind of entry into spine because you see so many injuries. And I worked in extended care facility where we did work with a lot of elderly patients, and some of them did have incontinence issues, which is why I'm kind of intrigued with one of your employees that has a specialty in that. I'd love to venture into that.
Okay. Where do you see yourself in 3 to 5 years?
3 to 5 years, I'd really like to solidify what specialty I'd like to get into, and hopefully specialize in it, get my certificate, and kind of move on from there. Hopefully I'll kind of find my niche.
Mm-hmm. Do you have any questions for us?
Yes, I actually was wondering what this schedule was like at your clinic and how many patients you see a day and on weekends if you have weekend shifts.
Okay. Well, so each therapist will work 8 hours a day, but we're open for 12 hours. So sometimes you'll do the morning shift, and then sometimes you'll work a little later. And each therapist sees about 10 to 12 patients per day.
Okay, great. My last question is, do you have any opportunities for continuing education?
Sure. We give each therapist a $1,500 stipend that you can use for any resources to get yourself to the continuing ed or pay for the course, kind of however you want to use it.
That's great. All right. And I would just like a business card if you have one.
Yeah, sure. Here we go.
Oh, thank you. All right. Well, thank you for meeting with me and having this opportunity.
You're welcome. Nice to meet you.
Nice to meet you too.